Hello, everyone, and thank you for joining us. I'm Scott Tomko from Healthcare Purchasing News. Today, we're here to talk about the implementation of cost, quality, and outcome strategies and some of the barriers people face when trying to create sustainable strategies. Our experts include Mr. Ashok Mutton, founder and CEO of SupplyCopia, a company dedicated to delivering elite real-time intelligence solutions in supply chain management. As founder and CEO, Mr. Mutton leads SupplyCopia in making healthcare systems utilize efficient technologies and software-based solutions to improve quality of care and reduce cost. In addition, we will be speaking to Dr. Jimmy Chung of Advantis Health Partners. As Chief Medical Officer of Advantis Health Partners, Dr. Chung is responsible for all clinical engagement strategies, as well as leadership, growth, and operational oversight of clinical transformation processes and innovations. Now I'm going to turn it over to Ashok, who is going to talk a little about the survey he conducted that served as a background for this webinar.
Thank you very much, Scott. Thanks for that introduction, and it's an honor to be with Dr. Chung. I always learn something from him every time we are speaking with each other. So the backdrop to this cost quality outcome initiative and why companies are unable to kick off their initiatives, we conducted a survey through LinkedIn, and we invited the participants to provide their feedback. Essentially, the feedback required them to talk about these four issues and how these four issues are either helping them or hampering them in successfully deploying a cost quality outcome solution. What was interesting was that the maturity and the quality of the data, 57% of the responders said that that's a big roadblock for them, followed by a 29% from the stakeholders. Lack of funds was the third one. And what interestingly was that lack of a suitable technology literally did not get anybody's attention. So while none of these are by, we are not hearing them for the first time, but what was very interesting is the maturity and the quality of the data, which we've been talking about for quite some time. That took the biggest percentage, which is a 57%. And we at SupplyCopia, we've been talking about it for quite some time. The importance of having a complete matured set of data is the single biggest foundations that organizations need in order to implement not only just a very successful cost quality outcome initiative, but gaining any kind of insight from their businesses, whether it is managing the item master data, whether it is integrating the data from multiple sources, meaning their ERP systems, EMR, EHR systems, and so on and so forth. We've been talking about it for quite some time. And organizations, if they were to invest in something like this, would be a great foundation to successfully implement CQO. And the most important thing these days is for organizations to get to break-even and profitability. A great data foundation will drive some of those things.
To talk a little bit about data maturity and quality, Ashok, how do you factor the wide variances in data quality and consistency that you find when health systems submit data from different systems?
It varies, right? The data maturity varies. What we have consistently seen is that irrespective of the size of the organization, the data challenges continue to remain there. And this is a result of the constant underinvestment that has happened in technology and data management and so on and so forth. So these challenges did not happen overnight. They have accumulated for over a period of time. And every organization has these challenges. And that's the reason why we kind of propose that, look, you have ERP systems, EMRs, EHRs, they have been given to you. look at them as the sources of data, but create a parallel universe and then leverage that parallel universe to analyze your data and get your insights, and you can still continue to leverage your ERP and EMR systems.
Dr. Chung, I know you're recognized for your work across clinical and supply chain organizations. What are some of the data challenges you've experienced in your role?
Yeah, great question. I've been really looking at the data from a clinical and supply chain perspective, and from how it applies to CQO, cost, quality, and outcomes, for over 10 years. And over that time, when we talk about data maturity, it means something different at each point during that journey. And so I think what we call data quality and data maturity 10 years ago is not the same as it is now. And as over time, the integrity and quality of the data becomes better, and we get better tools, better analytic tools. We're facing now a different kind of challenge, what I might say call data maturity 2.0, which is now that we have the data, and now it's in a platform that is digestible and is become more actionable, where is the leadership that can now take the data and translate it into actionable initiatives and policies? And clinicians, often clinical leaders, so physician leaders and chief medical officers and so forth, often may be familiar with the quality or the clinical quality data, but they're not necessarily familiar with the cost data that comes along. And especially if we try to put them all together, it takes, I think, a level of education and some experience to be able to say, now we can take this data and turn it into a story that you can tell in the boardroom, or in the C-suite, or in the OR, or in the doctor's lounge with your surgeons. And how do you actually make that into take that data and make it into action? I think that's really where now we're starting to see more challenges.
To stay with you, Dr. Chung, the discussion often comes up: is your supply chain strategic or tactical? How have you worked to make supply chain more strategic from your role?
Yeah, absolutely. This is a question that's being asked on a national scale. Everybody's talking about it. We've talked about it at ARM, and we've talked about it in other supply chain conferences and organizations. How do we become more of a strategic asset to both the healthcare provider organizations, and how do we develop partnerships with supplier organizations to become more strategic? And we learned a lot actually during COVID. As we struggled to become much more of a visionary, to set goals for organizations, COVID actually gave us it. As bad as the pandemic was, it opened the door for supply chain to step into that role. It was no longer about just get us what we need, but to take our resources and say, what's the best way to utilize optimize the utilization of our resources to get the best patient outcomes and best financial outcomes. And we had that all mapped out. Now is our chance to bring it forth to drive organizational strategy. So now I think the next step is for us to be able to deliver that on a clinical level, to be able to say, given the strategies that we have for supply chain and optimized utilization of our resources, how do we then turn that into our clinical strategy? How do we develop and build services that are required in certain communities through our healthcare organization? How do we pivot to maybe the healthcare at home or hospital at home, bring the products and services that are necessary to patients to where they are, to where they want it and where they need it? These are all different kinds of strategies that supply chain is ready to bring forth, and healthcare organizations can certainly benefit from that. And so part of what I do in my current role at Advantage Health Partners is to try to create that strategy that we can then deliver to both Bon Secours, Mercy Health, and other health organizations for the future, to be able to set that as the standard. You know, we have the capability to show how healthcare organizations can really start pivoting around supply chain and the capabilities that we have to help direct their clinical growth strategies.
Ashok, you've created a collaborative process to implement CQO, and I know that has more detail than we can dig into today. However, can you take us through some of the highlights of this collaboration you've seen modeled in provider organizations?
Sure. Just continuing from where Dr. Chung left off, right? And supply chain has to be strategic in nature. This is your second largest spend in the organization. And supply chain also sees the symptoms a lot before everyone else does, right? So we are looking at procedure data, we are looking at cost data, we are looking at outcomes data, we are looking at reimbursement data, we are looking at capacity. So all these things are very visible to the supply chain staff, right? So they are actually in the perfect position to be able to take a leadership role, make the whole supply chain strategic in nature. Currently, supply chain is looked at only as a way to reduce your cost. But I kind of argue that supply chain can also play a significant role in revenue, generating the net new revenues, but also talk about where are our next generation opportunities. Do we have enough capacity in the organization? How are we going to grow? Which are the procedures that we need to build, maybe new facilities, or maybe reorg the ones that are not doing all that well. So they have all of that information and insight, and they are in that position to actually drive the bus, right? And we at SupplyCopia, we feel that a clinically integrated supply chain is what the future looks like. So I kind of continuously say that the cost and revenue are two sides of the same coin. You can't address one without the other. We've continuously tried to address both of them in silos, and gotten somewhat substandard results on both the sides. So in SupplyCopia, we have created a very integrated data, technology, application, and recommendation process where we integrate all the sources of data in a very structured manner, but also in a forgiving manner. What I mean by forgiving manner is we often see health systems at different levels of maturity. And that level of maturity should not deny them the ability to create a perfect CQO and be able to not only reduce cost, but also be able to contribute to the revenues. So as you rightly said, we don't have enough time to go through the 10-step process that we have very clearly defined and deployed at multiple health systems, where irrespective of the maturity of the data and the processes of a health system, we have built this great data lake that takes into consideration all these deficiencies and kind of enhances the quality of the data, blah, blah, blah. And then, these recommendations are very specific insights, and recommendations are made to all the stakeholders. So we have tested this any number of times, and we've seen results. And as Dr. Chung was talking about, a very relevant thing is, one is to bring all the data together, and that's not really the end of the story. And that's actually the beginning of the story. Is that data is telling us something. What story is the data telling? Where do we need to go from there? And that's where getting a buy-in from various stakeholders, integrating all the stakeholders, and like answering what's in it for me that's where we go from where we are.
Now, Ashok, why would an organization that is strapped for cash want to make CQO a priority?
I'm going to steal one of the statements that Dr. Chung makes all the time, right? You have to spend money to make money, right?
Right.
And I don't mean that in a very flippant way. Is that we understand that currently we are facing a significant issue with reference to breaking even, profitability. The elective procedure volumes are not what they used to be. But at the same time, if you are going to look at needles in the haystack, is what I would say. In this case, not just one needle, but multiple needles in the haystack, then you would have to lay that foundation to get to where you want to be. It's like saying, I want to build an Empire State Building. But if you want to build an Empire State Building, assuming it's 150 some floors, you are going to require a foundation. You cannot say that I'm going to build Empire State Building with a 10-story foundation, right? So it's necessary to make that investment, but at the same time, that investment has to be done in a way that not only addresses the current challenges of shortfalls in the revenue and profitability, but once you are spending that money, you're spending it in a way that that takes care of you for the next couple of years to come as well.
And Dr. Chung, the same question for you. Why would an organization strapped for cash want to make CQO a priority, in your opinion?
Well, let me add a little twist to what Ashok said earlier. You have to spend money also to save money. And while, again, I would say the same, that I don't say that lightly, because to save money, to be able to identify those opportunities where you can actually become more efficient and save money, it does take some investment. So when we look at CQO, cost, quality, and outcome, right? This ties directly to, this is where the first two questions all get tied in. You need the data for cost, quality, and outcomes, and you need CQO, you need to make CQO a strategy, not just a tactic to reduce cost or improve quality and outcomes. It has to be your baseline strategy to where you want to go, and you need to be able to invest into that. Now, if you look at those three components, you'll recognize immediately that those are the three components of value. And the term value gets thrown out a lot. When we talk about, well, how do we define value? We look at value-based care, value-based care models, and improving value for our patient experience. Every healthcare organization has to have a value strategy. And those are the three components that would make up any kind of a value-based care strategy. And so that's where it gets all tied in. And if you don't pay attention to CQO, the three components of value, then you will not be able to thrive in a value-based care environment, which is coming soon. Now, it's partly there now through Medicare reimbursement and things like that, but as soon as we try to tackle the unsustainable cost of care delivery in this country, as it approaches 20% of our GDP, every hospital organization has to be willing to adopt a value-based care strategy. So that means reducing costs and reducing unnecessary utilization, and really being prepared to be reimbursed based on your clinical outcomes. And therefore, CQO definitely has to be that baseline, as Ashok said, the foundation for that, for a value-based care strategy. So in the end, maybe supply chain really isn't going to be, should we call it supply chain anymore? It's really about optimizing your utilization of resources. It's about reducing non-labor spend and making care standardized from a clinical perspective, standardizing to best practice so that we reduce not only variability in cost, but variability in the quality of care, reducing patient safety risks, and making sure that we provide a reliable, predictable outcome for all of our patients who need our care. And so from that perspective, yeah, supply chain, maybe we shouldn't call it supply chain anymore, any more than we should be calling it materials management. Remember the days when that's what we called it. So maybe it's time for us to rethink what that means. And really, again, going back to that other question, how does it become more of a strategic direction rather than a function within your hospital?
Well, thank you, Ashok and Dr. Chung. That was an invaluably informative presentation. On behalf of HPN and SupplyCopia, I would like to thank everyone who logged on to watch. Be sure to watch the other sessions in our forum, and please click the link at the top of your screen to return to the event hub.